so we've got the recommendation not to do in-person classes until September 28th. What needs to happen between now and then to be ready for that, to open up the doors on September 28th and welcome everybody back in? What do you want to see?
Well, let me start by saying that was a tough recommendation to make. My kids desperately want to get back in school, and Brittany and I desperately want to get them back into school. We always believed and loved our teachers, but now I've learned that I'm not a very good teacher myself. What we have to do, though, is to make sure that it's safe. And right now, it's not. We're at what I hope is the height of the virus in Kentucky. I hope that we can start decreasing cases, and we're never at this point again. We're seeing significant increase in positive cases amongst kids. Openings across the country are not going very well right now, and we still have families going to the beach, which is a real challenge because it brings so much virus back into Kentucky. So because of that, we need some extra time, and by providing a date like September 28th, it allows school districts to plan. So some are going to start virtually, some may change their calendar, but not having a date and just going 2 weeks at a time keeps school districts from making those types of plans and providing some type of instruction. So what we really need to see is our positivity rate come down. Right now it is north of 5%. It was over 6% for a day or two last week. We need to get that certainly below 5. I'd like to get it closer to 4. And what that means is that the virus is not spreading as significantly and not as quickly throughout the community. I'd like to see Congress go ahead and actually act. We need state stabilization. We need the increased unemployment payments to continue, but we also need the dollars for schools and school safety, which they talked about, but they haven't yet done. We need to make sure that we have plenty of time for our districts to plan on how to thin their classes out. Maybe that's an A-B schedule where people go certain days of the week. And we need to make sure that we've gone through, that we are protecting our most vulnerable teachers if they have certain conditions, and our most vulnerable students if they do too. So I think this gives us more time to get to a more stable place where the virus isn't spreading as much and we can better protect everyone in that classroom. I'm also a believer that if we go for 3 days and have to shut down, that doesn't help, that probably just pushes us back. And it's time to go ahead and have at least some certainty over the next 5 weeks.
A couple of concerns I know I've seen based on that recommendation has been one for the more rural districts who in some places it's not that they just don't have good internet access, they don't have any internet access. So how do districts like that, work under these ramifications? And then also back to the issue of parents who work, they rely on their kids to be out of the house so they can go to work. How do we support these families, these parents who need to go back to work and make money, yet also need to be with their kids now that they won't be in school for a little bit longer now?
It's a real challenge. This is a mean virus that attacks all the support systems that we have in our lives. It's harder to go to the doctor's office right now, though we need people to be going back for routine checkups. It's harder to do just about anything that we would normally do in our lives, and this is another serious impact. And unfortunately, it makes things harder on those that are already struggling. On internet access, we were able to secure significant funding from the federal government where school districts have been working on that issue. We are working right now on making more dollars available. There's some innovative programs that some other states are looking into, whether that's providing hotspots for kids that otherwise have no internet access and therefore can pick it up. We've got to make sure that each child can be connected with their school, connected with their teachers. We can't leave our children behind during this period. And working parents, it's so hard. It's so hard as we see this spreading through our daycares. But we know that if we started school right now, not only would it be spreading through the school, it would be spreading when the kids come home from school, which we think would have a significant impact on businesses themselves. If you've got a whole school that ultimately is infected and those kids have to quarantine and all their parents potentially have to quarantine too, you have a severe adverse effect on those jobs as well. So no easy answers, and it makes every decision hard. We're making the best decisions we can, though, based on the safety of not just the kids, but we're asking teachers to go in with less PPE than our healthcare workers and have a considerable amount of exposure. And we got to make sure that the cases are down if we're going to ask them to take that risk.